I'm board certified in psychiatry, sleep medicine, and integrative holistic medicine. I became interested in sleep medicine in my psychiatry residency, where I saw the impact of poor quality sleep and insufficient sleep on mental and physical health and well-being. And I saw how poor quality sleep can result in depression and irritability, fatigue, problems with concentration, headaches, tension, upset stomach, problems with work performance and school performance. And so I became really interested in learning how to address those issues with my patients. So after my psychiatry residency, I went on to complete my sleep medicine training. Sleep medicine is the field of medicine devoted to the diagnosis and management of sleep disorders. Sleep specialists have subspecialty training in sleep medicine. Because sleep medicine is such a multidisciplinary and multifaceted specialty, and because sleep affects so many different aspects of our life, you'll find that sleep specialists come from a variety of different backgrounds. So this includes internal medicine, pediatrics, psychiatry and neurology, anesthesiology, and ENT. There are a variety of different sleep disorders that are treated by sleep specialists. The most common sleep disorder that sleep specialists would be treating is sleep-disordered breathing, or sleep apnea, primarily. So sleep apnea is cessation of breathing during sleep, or stopping of breathing during sleep. So symptoms of that are snoring, waking up gasping or choking, restless sleep, unrefreshing sleep, waking up with headaches, sore throat, dry mouth, and issues with daytime concentration, daytime sleepiness, irritability, and fatigue. About 30 to 40% of people with high blood pressure have sleep apnea, and about 80% of people with treatment-resistant high blood pressure have sleep apnea. Untreated sleep apnea can lead to a variety of other health issues. People with sleep apnea are twice as likely to develop depression and twice as likely to have a stroke. There's also a higher risk of cardiac arrhythmias, such as atrial fibrillation. We also treat insomnia. About 10 to 40% of U.S. adults struggle with insomnia at some point in their lives. This is estimated to be as high as 50 or 60%. 10% or less struggle with chronic insomnia. So insomnia is defined as difficulty staying asleep, difficulty falling asleep, or waking up too early in the morning. Chronic insomnia is defined as insomnia 3 times a week or more for 3 months. Many people with chronic insomnia struggle with it for years and rely on sleep aids to help them sleep. One of my goals is to help people get off sleep aids and to improve the quality of their sleep naturally. Sleep specialists also treat circadian rhythm disorders, which are body clock disorders. So these include delayed circadian phase, which we often see in teenagers and young adults. So that's difficulty falling asleep at a decent hour and sleeping in too late. We also see advanced circadian phase, so that's falling asleep too early and waking up too early. So we'll see that frequently in the older population. Jet lag and shift work disorders are also circadian rhythm disorders. Sleep specialists also treat hypersomnias, such as narcolepsy, parasomnias, such as sleepwalking, and sleep-related movement disorders, such as restless leg syndrome and periodic limb movement disorder. The approach to treatment depends on the disorder that we're treating. So for example, if we're treating suspected sleep apnea, we'll start with diagnosis, which entails doing a sleep study. This particular clinic is not a sleep clinic, so if we do suspect sleep apnea, we'll refer you to a local sleep clinic and collaborate with your sleep specialist there on the diagnosis and the treatment. The gold standard treatment for sleep apnea is CPAP. But there are other treatments that can be considered depending on your situation. So for example, surgery may be considered if there is a physical obstruction that needs to be addressed. For insomnia disorders, CBTI, or cognitive behavioral therapy for insomnia, is the gold standard treatment. So this involves a variety of approaches, including sleep restriction, which is restricting the amount of time you're spending in bed, sleep hygiene, so addressing any bad habits that could be negatively impacting your sleep, stimulus control, so maintaining a consistent sleep schedule and avoiding naps, a cognitive approach, so addressing any maladaptive thoughts or attitudes that are negatively affecting your sleep, and relaxation training, so relaxing the mind and body. We also do have evidence for alternative therapies in the management of sleep disorders. So these include MBSR, or mindfulness-based stress reduction. Yoga and Tai Chi have a fair amount of evidence supporting their use in sleep disorders, along with acupressure. We'll also look at controlling your environment and your light and dark exposure, and utilizing bright light therapy or phototherapy as part of the treatment plan. In addition, we will use sleep aids judiciously when needed and when appropriate, and potentially vitamins and supplements when appropriate. In summary, sleep disorders have a significant impact on the quality of life for many people, and there are a variety of different sleep disorders that can be treated and a variety of different treatment approaches that we can employ. With my background in psychiatry, sleep medicine, and integrative holistic medicine, I'll be able to help guide you through various treatment options and find the best option for you to help improve the quality of your sleep naturally.